Hi, welcome to Logical Pharmacology. This video is a compilation of 250 high-yield examiners' favorite drugs. We'll begin our review with the cardiovascular drugs. First up, benazepril, lotensin. This drug is FDA approved to treat hypertension, congestive heart failure, and diabetic nephropathy. Benazepril blocks the conversion of angiotensin 1 to angiotensin 2 by inhibiting angiotensin-converting enzyme, the ACE. Next is enalapril, brand name Vasotec. Enalapril is indicated for hypertension, symptomatic heart failure, and asymptomatic LV dysfunction. It blocks the conversion of angiotensin 1 to angiotensin 2 by inhibiting ACE. Next, we have lisinopril, zestril. Lisinopril is primarily used for hypertension, heart failure, and acute myocardial infarction. Lisinopril blocks the conversion of angiotensin 1 to angiotensin 2 by inhibiting ACE. Let's look at the next one. Ramipril, altase. Ramipril is prescribed for hypertension, heart failure, cardiovascular risk reduction, and post-myocardial infarction. Ramipril blocks the conversion of angiotensin 1 to angiotensin 2 by inhibiting ACE. Alright, moving on to the next drug, losartan. Cozar. Losartan is approved for hypertension, diabetic nephropathy, and stroke risk reduction. Losartan blocks the binding of angiotensin 2 to the AT1 receptors on vascular smooth muscles. Next is olmesartan, Benicar. Indications are hypertension, heart failure, diabetic nephropathy. Mechanism is similar to losartan. Olmesartan blocks the binding of angiotensin 2 to the AT1 receptors on vascular smooth muscles. Then we have valsartan, Dioran, looking at its indications: hypertension, heart failure, and post-myocardial infarction. Valsartan again has a similar mechanism of action. It blocks angiotensin 2 from binding to and activating the AT1 receptor on vascular smooth muscles. Got it? Next card. Atenolol, tenormin. Atenolol is used for hypertension and angina. Mechanistically, atenolol is a cardioselective beta-1 blocker. Then we have bisoprolol, Zebeta. It is used for treating hypertension, heart failure, and angina. Bisoprolol is also a cardioselective beta-1 blocker. Next, metoprolol, succinate, and tartrate. Brand names are Toprol XL, Lopressor. Looking at the indications: hypertension, heart failure, angina, and myocardial infarction. Metoprolol 2 is a cardioselective beta-1 blocker. Alright, let's move on. Carvedilol, Coreg CR. It is indicated by the FDA for heart failure and hypertension. Carvedilol is a non-selective beta blocker with concurrent alpha-1 blocking properties. Then comes labetalol, which is available as a generic only. Clinically, you will use labetalol to treat chronic hypertension, hypertensive emergency, and hypertension in pregnancy. Labetalol is a non-selective beta blocker with concurrent alpha-1 blocking properties. Propranolol is also known by the brand Inderal LAXL. FDA-approved indications for propranolol include hypertension, arrhythmias, angina, migraine prophylaxis, essential tremors, infantile hemangioma, and myocardial infarction. Propranolol is a non-selective beta blocker. Next up, amlodipine, Norvax. This is indicated for patients who have hypertension, chronic stable angina, Prinzmetal's angina, and coronary artery disease. Amlodipine is a dihydropyridine calcium channel blocker. Then we have nifedipine ER, known by the brand name Procardia XL. Its indications include hypertension, Prinzmetal's angina, and chronic stable angina. Nifedipine is a dihydropyridine calcium channel blocker. Going ahead with the next drug, diltiazem, cardizem, Thiazac. Diltiazem is approved by the FDA for hypertension, angina, and supraventricular tachyarrhythmias. Diltiazem is a non-dihydropyridine calcium channel blocker. Next drug is verapamil. Calin SR. The drug is approved for hypertension, angina, supraventricular tachycardias, atrial fibrillations, and atrial flutter. Verapamil is a non-dihydropyridine calcium channel blocker. Okay, then we have bumetanide, Bumex. It is used for treating edema. Bumetanide is a loop diuretic that inhibits the sodium-potassium chloride symporter in the loop of Henle. Next, furosemide, Lasix. Lasix is approved by the FDA to treat edema and hypertension. Looking at its mechanism of action, furosemide is a loop diuretic that inhibits the sodium-potassium chloride symporter in the loop of Henle. Torsemide, known by the brand names Demodex, Soans. Torsemide is clinically used for edema and hypertension. Torsemide is a loop diuretic that inhibits the sodium-potassium chloride symporter in the loop of Henle. Drug generic chlorthalidone, known by Hygroton, Hemichlor. Chlorthalidone is useful for treating edema and hypertension. Mechanistically, chlorthalidone blocks the sodium chloride symporter in the distal convoluted tubule, a thiazide-like diuretic. Let's move on to hydrochlorothiazide, brand name, Microzide. Hydrochlorothiazide is used in patients with hypertension and edema. Hydrochlorothiazide is a thiazide diuretic that inhibits sodium chloride symporter, generic name spironolactone, brand name Aldactone. Its main indications are heart failure, hypertension, hyperaldosteronism, edema, and hypokalemia. Spironolactone is a potassium-sparing diuretic and an aldosterone receptor antagonist. Next is atorvastatin, known by the brand name Lipitor. In terms of its approved uses, hyperlipidemia, dyslipidemias, hypertriglyceridemia, familial cholesterolemia, primary and secondary prevention of cardiovascular events. Now for its mechanism of action. Atorvastatin inhibits HMG-CoA reductase that decreases cholesterol synthesis in the liver. Next we have pravastatin, available as generic only. Pravastatin is an FDA-approved go-to drug for patients with hyperlipidemia, familial hypercholesterolemia, heterozygous only, primary and secondary prevention of CV events. Its therapeutic effect comes from inhibiting HMG-CoA reductase that decreases cholesterol synthesis in the liver. Then, rosuvastatin, available as Creastor, Ezalar. Rosuvastatin is indicated for patients who have hyperlipidemia, mixed dyslipidemias, hypertriglyceridemia, familial hypercholesterolemia, primary and secondary prevention of CV events. Rosuvastatin inhibits HMG-CoA reductase that decreases cholesterol synthesis in the liver. Alright, next up, simvastatin, Zocor. Simvastatin is for patients with hyperlipidemia, mixed dyslipidemias, hypertriglyceridemia, familial hypercholesterolemia, primary and secondary prevention of CV events. Simvastatin works by inhibiting HMG-CoA reductase that decreases cholesterol synthesis in the liver. Generic name, aspirin/dipyridamole. Brand name, Agrinox. Pain, fever, inflammation, migraine, prevention of CV events and preeclampsia, and revascularization after CABG or angioplasty. Aspirin irreversibly inhibits COX-1, reducing platelet aggregation. Next card, clopidogrel, Plavix, approved for the treatment of acute coronary syndrome, STEMI and non-STEMI, recent myocardial infarction, recent stroke, established peripheral artery disease. Clopidogrel irreversibly blocks P2Y12 ADP receptors on platelets. Generic name, Prasugrel, brand name Effient. Prasugrel is prescribed in acute coronary syndrome, STEMI, and non-STEMI. The mechanism of action involves prasugrel irreversibly blocking P2Y12 ADP receptors on platelets. Next one is ticagrelor, known by the brand name Brilinta. Ticagrelor is used to reduce thrombotic events in acute coronary syndrome, ACS, managed with PCI. Ticagrelor reversibly blocks P2Y12 ADP receptors on platelets. Okay, moving on. Apixaban, brand name Eliquis. Apixaban is used for stroke prevention in atrial fibrillation, deep vein thrombosis, and pulmonary embolism. Mechanistically, apixaban is a direct oral anticoagulant that selectively and reversibly inhibits factor Xa. Next drug is dabigatran. Dabigatran is available with the brand name Pradaxa. Dabigatran is used for stroke prevention, deep vein thrombosis, and pulmonary embolism. Looking at the mechanism, dabigatran is a direct oral anticoagulant that reversibly inhibits thrombin, factor 2A, and the next drug is rivaroxaban, Xarelto, stroke prevention in atrial fibrillation, deep vein thrombosis, and pulmonary embolism. Rivaroxaban is a direct oral anticoagulant that selectively and reversibly inhibits factor Xa. Let's look at the next card. It is warfarin, known by the brand names Jantoven, Coumadin. Warfarin is used for the prophylaxis and treatment of deep vein thrombosis and pulmonary embolism, as well as for the prevention of thromboembolic complications. Mechanism of action. Warfarin inhibits the production of vitamin K by vitamin K epoxide reductase, VKET. Next drug is amiodarone, brands Pasirone, Cordarone. Amiodarone is useful for the treatment of recurrent ventricular fibrillations, atrial fibrillations, supraventricular tachycardia. Amiodarone blocks potassium channels, responsible for repolarization phase, which prolongs the cardiac action potential. Let's look at the next one. Digoxin. Its brand names are Digitec, Lanoxin. Digoxin is used for the treatment of heart failure with reduced ejection fraction and atrial fibrillations. Digoxin is a cardiac glycoside that inhibits sodium-potassium ATPase pump in the membranes of cardiac muscle cells. Sacubitril plus valsartan. This combination comes in a brand name, Entresto. It got FDA approval for heart failure with reduced ejection fraction and symptomatic chronic heart failure with LV dysfunction. Sacubitril inhibits neprilysin, an enzyme that breaks down vasoactive peptides like BNP and bradykinin. Valsartan is an angiotensin II receptor blocker. Moving on. Hydralazine plus isosorbide dinitrate, brand name Bidal. Indications are heart failure and angina. Hydralazine is a direct-acting arterial vasodilator. Isosorbide dinitrate is a potent venous vasodilator. Next, isosorbide mononitrate, Imdur. It is approved by the FDA for the prophylaxis and treatment of chronic stable angina pectoris. Isosorbide mononitrate is a vasodilator, primarily on the venous system. The final drug of the cardiovascular part is nitroglycerin, brand names Nitrostat. Rectiv. Clinically, nitroglycerin is used to treat acute myocardial infarction, angina pectoris, and chronic anal fissures. Nitroglycerin forms free radical nitric oxide, activates guanylate cyclase, result in increase in cyclic GMP in tissues. This causes dephosphorylation and contraction. Alright, let's move into our next major section. Drugs acting on the nervous system. First up, citalopram, Celexa. This drug is FDA approved for major depressive disorder. Mechanistically, citalopram is a selective serotonin reuptake inhibitor, or SSRI. Next is escitalopram, brand name Lexapro. Escitalopram is indicated for major depressive disorder and generalized anxiety disorder. It is also a selective serotonin reuptake inhibitor, or SSRI. Next, we have fluoxetine. Prozac. Fluoxetine is primarily used for major depressive disorder, obsessive-compulsive disorder, bulimia nervosa, and panic disorder. Like the others, fluoxetine is a selective serotonin reuptake inhibitor, SSRI. Let's look at the next one. Paroxetine, Paxil. Paroxetine is prescribed for major depressive disorder, OCD, panic disorder, social anxiety disorder, and PTSD. The mechanism is the same. Paroxetine is a selective serotonin reuptake inhibitor, SSRI. Moving on, sertraline. Zoloft. Sertraline is approved for major depressive disorder, OCD, panic disorder, social anxiety, PTSD, and premenstrual dysphoric disorder. And again, sertraline is a selective serotonin reuptake inhibitor, SSRI. Alright, next drug, desvenlafaxine. Pristiq. This one is indicated for major depressive disorder. Now, the mechanism is different. Desvenlafaxine is a serotonin and norepinephrine reuptake inhibitor, or SNRI. Next is duloxetine, Cymbalta. Indications include major depressive disorder, generalized anxiety, diabetic peripheral neuropathic pain, and fibromyalgia. Duloxetine is also a serotonin and norepinephrine reuptake inhibitor, SNRI. Then we have venlafaxine, Effexor XR. Looking at its indications, major depressive disorder, generalized anxiety, social anxiety, and panic disorder. And its mechanism, venlafaxine is a serotonin and norepinephrine reuptake inhibitor, SNRI. Got it? Next card, amitriptyline, which is available as a generic only. Clinically, you'll use this for depression. Amitriptyline is a tricyclic antidepressant, or TCA, that inhibits the reuptake of serotonin and norepinephrine. Next, nortriptyline, Pamelor. This one is also used for depression. Nortriptyline is another tricyclic antidepressant, a TCA, that primarily inhibits the reuptake of norepinephrine. Alright, let's move on. Bupropion, Wellbutrin or Zyban. It's indicated by the FDA for depression as a smoking cessation aid and for seasonal affective disorder. Bupropion is a norepinephrine dopamine reuptake inhibitor, or NDRI. Then comes mirtazapine, Remeron. It's approved for depression. Mirtazapine is a tetracyclic antidepressant that antagonizes central alpha-2 adrenergic and serotonin, 5-HT2 and 5-HT3 receptors. Next up, trazodone, Desyrel. This is indicated for patients who have depression. Trazodone is a serotonin antagonist and reuptake inhibitor, or SARI. Next is phenelzine, brand name Nardil. Phenelzine is indicated for non-endogenic or neurotic depression. Mechanistically, phenelzine is a monoamine oxidase inhibitor, an MAOI, that increases levels of amine neurotransmitters. Okay, moving on to the next drug. Aripiprazole, Abilify. This is used for schizophrenia, bipolar disorder, depression, and agitation. Aripiprazole is an atypical antipsychotic with partial agonist activity at dopamine, D2, and serotonin 5-HT1A receptors. Next, clozapine, Clozaril. This is a go-to for treatment-resistant schizophrenia and recurrent suicidal behavior. Clozapine is an atypical antipsychotic with antagonist activity at dopamine, D4, and serotonin 5-HT2A receptors. Then we have haloperidol, Haldol. Looking at its indications, schizophrenia, Tourette's disorder, severe behavioral disorders, and acute psychosis. Haloperidol is a typical antipsychotic. It works by competitively blocking dopamine D2 receptors. Next drug is lurasidone, Latuda. The drug is approved for schizophrenia and bipolar depression. Lurasidone is an atypical antipsychotic that blocks dopamine D2 and serotonin 5-HT2A receptors. Let's look at the next one. Olanzapine, Zyprexa. Olanzapine is prescribed for schizophrenia and bipolar disorder. Its therapeutic effect comes from blocking dopamine, D2, and serotonin 5-HT2A receptors. Alright, next up, quetiapine, Seroquel. Quetiapine is for patients with depression, schizophrenia, and bipolar disorder. Quetiapine also works by blocking dopamine, D2, and serotonin 5-HT2A receptors. Next card, risperidone, Risperdal. Approved for the treatment of schizophrenia, bipolar disorder, and irritability associated with autism. Risperidone is an atypical antipsychotic that blocks dopamine, D2, and serotonin 5-HT2A receptors. Got it? Let's move to alprazolam, brand name Xanax. It's used for treating anxiety and panic disorder. Mechanistically, alprazolam enhances the effect of the neurotransmitter GABA. Next, buspirone, which is available as a generic only. Clinically, you will use buspirone to treat anxiety disorder. Buspirone partially blocks the serotonin 5-HT1A receptor. Then we have clonazepam, Klonopin. It is used for treating seizures and panic disorder. Clonazepam also enhances the effects of the neurotransmitter GABA. Next, diazepam, Valium. Looking at the indications, anxiety, alcohol withdrawal, spasms, seizures, and preoperative anxiety. Diazepam is a long-acting benzodiazepine that enhances the effects of the neurotransmitter GABA. Alright, let's move on. Lorazepam, Ativan. It is indicated by the FDA for anxiety disorders, anxiety-related insomnia, and status epilepticus. Lorazepam enhances the effects of the neurotransmitter GABA. Then comes temazepam, Restoril. This is indicated for the short-term treatment of insomnia. Temazepam, like the other benzos, enhances the effects of the neurotransmitter GABA. Next up, carbamazepine, Tegretol. This is indicated for patients who have seizures, trigeminal neuralgia, and bipolar disorders. Carbamazepine is an anticonvulsant that blocks voltage-gated sodium channels. Next up, Divalproex, or valproic acid, Depakote. FDA-approved indications include seizures, migraine prophylaxis, and mania associated with bipolar disorder. Mechanistically, divalproex and valproic acid increase GABA levels and also block voltage-gated sodium channels. Next is ethosuximide, Zarontin. Its indication is specifically for absent seizures. The mechanism involves ethosuximide blocking T-type calcium channels in thalamic neurons. Then we have gabapentin, Neurontin, looking at its indications. Partial seizures, postherpetic neuralgia, and restless leg syndrome. Gabapentin works by binding to the alpha-2 delta subunit of voltage-gated calcium channels, which reduces the release of glutamate. Next drug is lamotrigine, Lamictal. The drug is approved for seizures and as a maintenance treatment for bipolar disorder. Lamotrigine blocks voltage-gated sodium channels and inhibits glutamate release. Let's look at the next one. Levetiracetam, Keppra. This is prescribed for seizures. Levetiracetam's mechanism involves binding to the synaptic vesicle protein 2A or SV2A. Alright, next up, oxcarbazepine, Trileptal. Oxcarbazepine is for patients with partial onset seizures. Oxcarbazepine works by blocking voltage-gated sodium channels. Next card, phenytoin, Dilantin. Approved for generalized tonic-clonic seizures, complex partial seizures, and status epilepticus. Phenytoin also blocks voltage-gated sodium channels. Next one is pregabalin, known by the brand name Lyrica. Pregabalin is used to treat neuropathic pain, fibromyalgia, and seizures. Its mechanism involves binding to the alpha-2 delta subunit of voltage-gated calcium channels. Okay, moving on. Topiramate, brand name Topamax. Topiramate is used for seizures and migraine prophylaxis. It has a complex mechanism. Topiramate blocks sodium channels, enhances GABA activity, and antagonizes glutamate receptors. Next drug is amphetamine/dextroamphetamine, Adderall. This is used for ADHD and narcolepsy. Mechanistically, Adderall promotes the release of dopamine and norepinephrine. And the next drug is atomoxetine, Strattera. This is also used for ADHD. Looking at the mechanism, atomoxetine is a selective norepinephrine reuptake inhibitor, or SNRI. Let's look at the next card. It is lisdexamfetamine, known by the brand name Vyvanse. This is used for ADHD and binge eating disorder. Lisdexamfetamine is a prodrug of dextroamphetamine that promotes the release of dopamine and norepinephrine. Next drug is methylphenidate. Brands Concerta. Ritalin. Methylphenidate is useful for the treatment of ADHD and narcolepsy. Methylphenidate is a central nervous system stimulant that blocks the reuptake of norepinephrine and dopamine. Let's look at the next one. Buprenorphine. Belbuca. This is used for opioid dependence and pain. Buprenorphine is a partial agonist at the mu opioid receptor and an antagonist at the kappa opioid receptor. Next, codeine. Available in combination products. It is used for pain and cough. Codeine is an opioid agonist that binds to mu opioid receptors. Then comes fentanyl, Duragesic, Sublimars. It is indicated by the FDA for severe pain and anesthesia. Fentanyl is a potent synthetic opioid agonist that acts on mu opioid receptors. Next up, hydrocodone/acetaminophen, NORCO, Vicodin. This is indicated for patients who have moderate to severe pain. Hydrocodone is a strong agonist of the mu opioid receptor, while acetaminophen inhibits prostaglandin synthesis. Then we have hydromorphone, Dilaudid. It is used for treating severe pain. Hydromorphone is a potent semi-synthetic opioid agonist that acts on mu opioid receptors. Next, methadone, Metadose, Dolophine. It is used for opioid dependence and severe pain. Methadone is a long-acting synthetic opioid agonist and also an NMDA receptor antagonist. All right, let's move on. Morphine, MS-Contin. It is indicated for severe pain. Morphine is a natural opioid agonist that binds to mu opioid receptors. Next is oxycodone, OxyContin, Roxicodone. Indications are moderate to severe pain. Mechanistically, oxycodone is an opioid agonist that binds to mu opioid receptors. Then we have tramadol, Ultram, Conzip. Looking at its indications, moderate to severe pain. Tramadol is a centrally acting analgesic that binds to mu opioid receptors and also inhibits the reuptake of serotonin and norepinephrine. Got it? Next card, donepezil, Aricept, Adlarity. Donepezil is used for Alzheimer's disease. It works by reversibly inhibiting acetylcholinesterase, which increases acetylcholine concentration. Next, memantine, Namenda. This is also used for Alzheimer's disease. Memantine is a non-competitive NMDA receptor antagonist. All right, let's move on. Rivastigmine, Exelon. It is indicated by the FDA for Alzheimer's and Parkinson's dementia. Rivastigmine is a reversible acetylcholinesterase and butyrylcholinesterase inhibitor. Then comes lithium, Litobid. It is used for bipolar disorder. The full mechanism is unknown, but it's proposed to involve the modulation of intracellular signaling pathways. Next up, carbidopa/levodopa, Sinemet. This is indicated for patients who have Parkinson's disease and Parkinsonism. Levodopa is a dopamine precursor, and carbidopa inhibits its peripheral conversion. Then we have pramipexole, Mirapex. It is used for treating Parkinson's disease and restless leg syndrome. Pramipexole is a non-ergot dopamine agonist. Next, ropinirole, Requip. It is used for Parkinson's disease and restless leg syndrome. Ropinirole is also a non-ergot dopamine agonist. Alright, let's move on. Sumatriptan, Emitrex. It is indicated for migraine and cluster headaches. Sumatriptan is a selective serotonin 5-HT1B/1D receptor agonist that causes vasoconstriction. Next is varenicline, which is available as a generic only. Its indication is for smoking cessation. Varenicline is a partial agonist at the alpha-4 beta-2 nicotinic acetylcholine receptor. Then we have zolpidem, Ambien, Edluar. Looking at its indication, insomnia. Zolpidem is a non-benzodiazepine hypnotic that selectively binds to the GABA-A alpha-1 subunit. Next drug is acetaminophen, Tylenol. The drug is approved for pain and fever. Acetaminophen inhibits prostaglandin synthesis in the central nervous system. And the last one for this section, lidocaine, Lidoderm. It's used for local anesthesia and arrhythmias. Lidocaine works by blocking voltage-gated sodium channels and prevents the influx of sodium into nerve and cardiac cells, which inhibits the propagation of electrical signals. Alright, that's a big section done. Let's move on to our anti-infectives. Kicking off this section, amoxicillin/clavulanate. Augmentin. This is indicated for a wide range of infections: upper and lower respiratory tract, skin, and urinary tract infections. Amoxicillin kills bacteria by inhibiting cell wall synthesis. The clavulanate ensures its effectiveness by deactivating bacterial beta-lactamase enzymes that would otherwise break down the amoxicillin. Next is ampicillin, Omnipen, Principen. Ampicillin is indicated for bacterial meningitis, septicemia, endocarditis, and respiratory, GI, and GU infections. It also works by inhibiting bacterial cell wall synthesis. Next, we have penicillin, VK. Pen-VK. This is primarily used for mild to moderate infections of the upper respiratory tract, skin, and oropharynx, as well as for prophylaxis of rheumatic fever. Penicillin VK also inhibits bacterial cell wall synthesis. Let's look at the next one. Cefdinir, available as a generic. Cefdinir is prescribed for acute bacterial otitis media, sinusitis, community-acquired pneumonia, and skin infections. Cefdinir is a third-generation cephalosporin that inhibits bacterial cell wall synthesis. Moving on, cephalexin, Keflex, Biocef. Cephalexin is approved for respiratory tract infections, otitis media, skin infections, and bone infections. This is a first-generation cephalosporin that inhibits bacterial cell wall synthesis. Alright, next drug, doxycycline. Vibramycin. This one is indicated for a wide range of infections, including rickettsial infections, STDs, respiratory infections, anthrax, acne, and malaria prophylaxis. Now the mechanism is different. Doxycycline is a tetracycline antibiotic that binds to the 30S ribosomal subunit to inhibit protein synthesis. Next is minocycline, Solodin, Minocin. Indications include bacterial, chlamydial, and mycobacterial diseases, and it's also an adjunctive treatment for severe acne. Minocycline also works by inhibiting bacterial protein synthesis. Then we have ciprofloxacin, Cipro, looking at its indications: respiratory, urinary, bone and joint, and skin infections, as well as STDs, plague, and anthrax. Ciprofloxacin works by inhibiting bacterial DNA gyrase. Got it? Next card, levofloxacin, levaquin. This is used for nosocomial pneumonia, CAP sinusitis, UTIS, and skin infections. Mechanistically, levofloxacin inhibits bacterial DNA gyrase and topoisomerase 4. Next, atazanavir, Rayataz. This is used for the treatment of HIV-1 infection in combination with other antiretrovirals. Atazanavir is an antiretroviral protease inhibitor that prevents HIV viral maturation. Alright, let's move on. Cobicistat, Tybost. This is an HIV pharmacokinetic enhancer or booster used in combination with atazanavir or darunavir. Cobicistat is a CYP3A inhibitor that increases the plasma concentration of the combined drugs. Then comes darunavir, P-Zista. It is indicated by the FDA for HIV infection. Darunavir is an antiretroviral protease inhibitor that prevents HIV viral maturation. Next up, emtricitabine, Emtriva. This is indicated for patients who have HIV infection or are using it for HIV pre-exposure prophylaxis. Emtricitabine is an antiretroviral nucleoside reverse transcriptase inhibitor or NRTI. Then we have raltegravir, Icentress. It is used for treating HIV infection. Raltegravir is an antiretroviral integrase strand transfer inhibitor or INSTI. Next, ritonavir, Norvir. It is used for HIV infection, primarily as a booster. Ritonavir is an antiretroviral protease inhibitor used as a pharmacokinetic enhancer and CYP3A4 inhibitor. Alright, let's move on. Tenofovir/alafenamide, Vemlidy. It is indicated for HIV infection and hepatitis B. Tenofovir is an antiretroviral nucleoside reverse transcriptase inhibitor. Next is dolutegravir/abacavir/lamivudine, Triumeq. This combination is used for HIV infection. It combines an NSTI with two NRTIs. Going ahead with the next drug, acyclovir, Zophyrex. Acyclovir is approved by the FDA for herpes virus infections. Acyclovir works by inhibiting viral DNA polymerase. Next drug is oseltamivir, Tamiflu. The drug is approved for influenza treatment and prophylaxis. Oseltamivir is an antiviral that inhibits the influenza virus neuraminidase enzyme. Let's look at the next card. It is valacyclovir, known by the brand name Valtrex. This is also used for herpes virus infections. Valacyclovir is a prodrug of acyclovir that inhibits viral DNA synthesis. Next drug is valganciclovir, Valcyte. This is useful for the treatment of cytomegalovirus infections. Valganciclovir is also a prodrug of acyclovir that inhibits viral DNA synthesis. Let's look at the next one. Sofosbuvir/velpatasvir, Epclusa. This combination is used to treat hepatitis C infection. It combines an HCV NS5B polymerase inhibitor with an NS5A inhibitor. Next, clotrimazole, Lotrimin, Miscelex. It is used for treating oropharyngeal, vulvovaginal, and cutaneous candidiasis, as well as tinea infections. Clotrimazole inhibits ergosterol synthesis, which disrupts the fungal cell membrane. Then comes fluconazole. Diflucan. It is indicated by the FDA for various forms of candidiasis and cryptococcal meningitis. Fluconazole also inhibits ergosterol synthesis, disrupting the fungal cell membrane. Next up, nystatin, mycostatin, Nystex. This is indicated for patients who have candidiasis, oral, intestinal, cutaneous, or vulvovaginal. Nystatin is a polyene antifungal that binds to ergosterol in the fungal cell membrane, causing leakage. Then we have terbinafine, Lamisil. It is used for treating onychomycosis, which is nail fungus, and tinea infections. Terbinafine is an allylamine antifungal that inhibits squalene epoxidase. Got it? Next card. Azithromycin, Zithromax or Z-Pak. Azithromycin is used for COPD exacerbations, community-acquired pneumonia, pharyngitis, and skin infections. Azithromycin binds to the 50S ribosomal subunit to inhibit protein synthesis. Next, clarithromycin. By-Xn, it is used for pharyngitis, community-acquired pneumonia, sinusitis, skin infections, and in combination for H. pylori eradication. Clarithromycin also binds to the 50S ribosomal subunit to inhibit protein synthesis. All right, let's move on. Clindamycin, Cleocin, Clendigel. It is indicated for serious systemic infections, including some MRSA, and is also used for acne and bacterial vaginosis. Clindamycin binds to the 50S ribosomal subunit to inhibit protein synthesis. Then comes linezolid, a Zyvox. This is a go-to for vancomycin-resistant Enterococcus faecium infections, nosocomial pneumonia, and complicated skin infections. Linezolid also works by binding to the 50S ribosomal subunit to inhibit protein synthesis. Next up, metronidazole, Flagyl. This is indicated for anaerobic bacterial infections, amoebiasis, trichomoniasis, and bacterial vaginosis. Metronidazole disrupts DNA and protein synthesis in susceptible organisms. Then we have mupirocin Bictroban. This is a topical antibiotic used for impetigo and for the eradication of nasal colonization of MRSA. Mupirocin inhibits bacterial protein synthesis by binding to isoleucyl tRNA synthetase. Next, nitrofurantoin, Macrobid, Macrodantin. It is used for uncomplicated lower urinary tract infections. Nitrofurantoin is reduced by bacterial flavoproteins to reactive intermediates that damage bacterial DNA. All right, let's move on. Sulfamethoxazole/trimethoprim, Bactrim. It is indicated for UTIS, acute otitis media, shigellosis, and pneumocystis pneumonia. This combination inhibits sequential steps in the bacterial synthesis of folic acid. Next is vancomycin, vancomycin. Indications are gram-positive infections, MRSA, and Clostridium difficile when given orally. Mechanistically, vancomycin inhibits bacterial cell wall synthesis. Going ahead with the next drug, isoniazid, N-Ydrazid, Hyzid. Isoniazid is approved by the FDA for all forms of tuberculosis. Isoniazid works by inhibiting the synthesis of mycolic acids in the mycobacterial cell wall. Next drug is rifampin, rifadin, rimactane. The drug is approved for all forms of TB, always with other drugs, and for asymptomatic carriers of Neisseria meningitidis. Rifampin is a rifamycin antibiotic that inhibits bacterial RNA polymerase. And the final drug in this section, rifaximin, Agfaxan. Rifaximin is used for traveler's diarrhea, irritable bowel syndrome with diarrhea, and hepatic encephalopathy. Rifaximin is a poorly absorbed rifamycin antibiotic that inhibits bacterial RNA synthesis. Got all those? Let's move on to the endocrine and metabolic disorders. First up here, canagliflozin. Invokana. This is used for type 2 diabetes. Canagliflozin is an SGLT2 inhibitor that reduces renal glucose reabsorption. Next, empagliflozin. Jardiance. Indications are type 2 diabetes and heart failure. Empagliflozin is also an SGLT2 inhibitor that reduces renal glucose reabsorption. Next, we have glimepiride. Amaryl. This is also for type 2 diabetes. Glimepiride is a sulfonylurea that stimulates insulin release from pancreatic beta cells. Let's look at the next one. Glipizide, glucotrol. This is prescribed for type 2 diabetes. Glipizide is also a sulfonylurea that stimulates insulin release from pancreatic beta cells. Moving on, linagliptin, Tradjenta. This is approved for type 2 diabetes. Linagliptin is a dipeptidyl peptidase 4 or DPP4 inhibitor that increases incretin levels. Alright, next drug, metformin, Fortamet, glucophage. This one is indicated for type 2 diabetes and polycystic ovarian syndrome, or PCOS. Metformin is a biguanide that decreases hepatic glucose production and increases insulin sensitivity. Next is pioglitazone, Actos. Indications are for type 2 diabetes. Pioglitazone is a thiazolidinedione that acts as a PPAR gamma agonist to increase insulin sensitivity. Then we have sitagliptin, Januvia. Looking at its indication, type 2 diabetes. Sitagliptin is another DPP4 inhibitor that increases incretin levels. Got it? Next card, levothyroxine, Centroid, Levoxriel. This is used for hypothyroidism. Mechanistically, levothyroxine is a synthetic form of the thyroid hormone thyroxine, or T4. Next, liothyronine, Cytomel. It is used for treating hypothyroidism. Liothyronine is a synthetic form of the thyroid hormone triiodothyronine, or T3. Alright, let's move on. Metimazole, Tapazole, Nortex. It is indicated by the FDA for hyperthyroidism. Metimazole works by inhibiting the synthesis of thyroid hormones. Then comes propeltioracil, or PTU, available as generic only. It is also indicated for hyperthyroidism. Propeltioracil also inhibits the synthesis of thyroid hormones. Next up, alendronate, Fosamax. This is indicated for patients who have osteoporosis. Alendronate inhibits osteoclast-mediated bone resorption. Then we have ibandronate, Boniva. It is used for treating osteoporosis. Ibandronate also works by inhibiting osteoclast-mediated bone resorption. Next, calcitonin, Myocalcin. It is used for osteoporosis and hypercalcemia. Calcitonin is a hormone that inhibits osteoclastic bone resorption. Alright, let's move on. Raloxifene, Evista. It is indicated for osteoporosis and to reduce breast cancer risk. Raloxifene is a selective estrogen receptor modulator, or SERM. Next is cholesevelam, Welchol. Indications are hyperlipidemia and type 2 diabetes. Cholesevelam is a bile acid sequestrant that binds bile acids in the intestine. Going ahead with the next drug, ezetimibe, Zetia. Ezetimibe is approved by the FDA for hypercholesterolemia. Ezetimibe inhibits cholesterol absorption at the brush border of the small intestine. Next drug is fenofibrate, Tricor. The drug is approved for hypertriglyceridemia and dyslipidemia. Fenofibrate is a PPAR alpha activator that increases lipoprotein lipase activity. Let's look at the next card. It is gemfibrozil, known by the brand name Lopid. This is used for hypertriglyceridemia. Gemfibrozil is a fibric acid agent that activates PPAR alpha to increase lipoprotein lipase activity. Next drug is niacin, Niaspan. This is useful for the treatment of dyslipidemia and pellagra. Niacin is vitamin B3, which inhibits lipolysis in adipose tissue. Let's look at the next one. Cholecalciferol, or vitamin D3. Dicara, Replesta. This is used for vitamin D deficiency. Cholecalciferol is a fat-soluble vitamin that promotes intestinal calcium absorption. Next, cyanocobalamin, or vitamin B12. Nascobal, Dodex. It is used for treating vitamin B12 deficiency. Cyanocobalamin is a synthetic form of vitamin B12, essential for various metabolic processes. Then comes ergocalciferol, or vitamin D2. Drisdol. It is also indicated for vitamin D deficiency. Ergocalciferol is a fat-soluble vitamin that promotes intestinal calcium absorption. Next up, folic acid, available generic. This is indicated for anemia and folate deficiency. Folic acid is a B vitamin essential for erythropoiesis and DNA synthesis. Then we have potassium chloride, chlorcon micro K. It is used for hypokalemia treatment and prevention. Potassium chloride is an electrolyte supplement used to replete potassium levels. Next, sevelamer, Renvala, Renagel. It is used for hyperphosphatemia in chronic kidney disease. Sevelamer is a non-absorbable, non-calcium phosphate binder. All right, let's move on. Allopurinol, Xyloprim. It is indicated for gout and recurrent calcium oxalate kidney stones. Allopurinol is a xanthine oxidase inhibitor that decreases uric acid production. Next is colchicine, Col-Cryas. Indications are gout and familial Mediterranean fever. Colchicine is an anti-inflammatory agent that inhibits microtubule polymerization. And the final drug in this section, phytonadione or vitamin K1, Mephiton. This is used for bleeding and for warfarin reversal. Phytonadione is a cofactor for the synthesis of coagulation factors 2, 7, 9, and 10. All right, next section. Let's talk about respiratory system drugs. Starting with the bronchodilators, albuterol, Proair HFA, or Ventolin HFA. This is used for asthma, COPD, and bronchospasm. Albuterol is a short-acting beta-2 adrenergic receptor agonist. Next, salmeterol, Cerivent Discus. It is used for treating asthma and COPD. Salmeterol is a long-acting beta-2 adrenergic agonist, or LABA, that causes bronchodilation. Next, we have beclomethasone, QVAR, Redehaler. This is also for asthma and COPD. Beclomethasone is an inhaled corticosteroid with anti-inflammatory properties. Let's look at the next one. Budesonide, Entocort EC oral, Pulmicort. This is prescribed for asthma and Crohn's disease. Budesonide is an anti-inflammatory corticosteroid. Moving on, fluticasone, Flovent-Discus. This is approved for asthma and allergic rhinitis. Fluticasone is an inhaled or intranasal corticosteroid with potent anti-inflammatory effects. All right, next drug. Mometasone/formoterol, Dulera. This one is indicated for allergic rhinitis, asthma, and dermatoses. Mometasone is a potent corticosteroid with anti-inflammatory properties. Next is ipratropium, Atrovent HFA. Indications are COPD and asthma. Ipratropium is a short-acting muscarinic antagonist, or SAMA, that causes bronchodilation. Then we have tiotropium, Spiriva, Handihaler, looking at its indications, COPD and asthma. Tiotropium is a long-acting muscarinic antagonist, or LAMA, that causes bronchodilation. Got it? Next card. Fluticasone/salmeterol, Advair Discus. This combination is used for asthma and COPD. It combines an inhaled corticosteroid with a long-acting beta-2 agonist, or LABA. Next, budesonide/formoterol, Symbicort, Breyna. It is used for treating asthma and COPD. This also combines an inhaled corticosteroid with a long-acting beta-2 agonist. All right, let's move on. Fluticasone/umeclidinium/vilanterol, Trelegy ellipta. It is indicated by the FDA for COPD and asthma. This is a triple therapy inhaler combining an ICS, a LAMA, and a LABA. Then comes azelastine, Astepro. It is indicated for allergic rhinitis. Azelastine is a histamine H1 receptor antagonist. Next up, diphenhydramine, Benadryl. This is indicated for patients who have allergies, insomnia, and pruritus. Diphenhydramine is a first-generation H1 receptor antagonist with significant anticholinergic effects. Then we have benzonatate, Tesalon Perles. It is used for treating cough. Benzonatate is an antitussive that anesthetizes stretch receptors in the lungs and airways. Next, dextromethorphan/promethazine, Promethazine, DM. It is used for cough. Dextromethorphan is an NMD, a receptor antagonist that acts as a cough suppressant, while promethazine blocks histamine H1 receptors. All right, let's move on. Montelukast, singular. It is indicated for asthma and allergic rhinitis. Montelukast is a leukotriene receptor antagonist. Next is theophylline, theocron, elixophyllin. Indications are asthma and COPD. Theophylline is a methylxanthine that causes bronchodilation by inhibiting phosphodiesterase. And the final drug in this section, Dornase alpha, pulmozyme. This is used for cystic fibrosis. Dornase alpha is a recombinant human DNase that selectively cleaves extracellular DNA in mucus. Moving right along, let's cover gastrointestinal and hepatic drugs. First up, esomeprazole, Nexium. This is a go-to for GERD and peptic ulcers. Esomeprazole is a proton pump inhibitor, or PPI, that suppresses gastric acid secretion. Next, lansoprazole, Prevacid. It is used for treating GERD and peptic ulcers. Lansoprazole is also a proton pump inhibitor that suppresses gastric acid secretion. Next, we have omeprazole, Prilosec. This is also for GERD and peptic ulcers. Omeprazole is another proton pump inhibitor that suppresses gastric acid secretion. Let's look at the next one. Pantoprazole, Protonix. This is prescribed for GERD and erosive esophagitis. Pantoprazole is also a proton pump inhibitor that suppresses gastric acid secretion. Moving on, famotidine, Pepcid, Zantac 360. This is approved for GERD and peptic ulcers. Famotidine is a histamine, H2 receptor antagonist that decreases gastric acid production. All right, next drug, aprepitant, Emend, Cinquanta. This one is indicated for chemotherapy-induced nausea and vomiting. Aprepitant is a neurokinin 1, or NK1, receptor antagonist that blocks the action of substance P in the brain. Next is dronabinol, Marinol. Indications are chemotherapy-induced nausea/vomiting and anorexia in patients with AIDS. Dronabinol is a synthetic cannabinoid that acts as an agonist at cannabinoid receptors. Then we have granisetron, Sancuso, looking at its indications, nausea and chemotherapy, induced nausea, vomiting. Granistron is a serotonin, 5-HT3 receptor antagonist. Got it? Next card. Ondansetron, Zofran. This is used for nausea and vomiting. Mechanistically, ondansetron is also a serotonin, 5-HT3 receptor antagonist. Next, prochlorperazine, Compazine, Compro. It is used for treating nausea, vomiting, and psychosis. Prochlorperazine is a typical antipsychotic that blocks D2 dopamine receptors in the brain's chemoreceptor trigger zone. All right, let's move on. Promethazine, Phanergan. It is indicated by the FDA for nausea, vomiting, and allergic conditions. Promethazine is a first-generation H1 receptor antagonist with anticholinergic and sedative properties. Then comes scopolamine, Transderm Scop. It is indicated for motion sickness and postoperative nausea, vomiting. Scopolamine is an anticholinergic and antimuscarinic agent. Next up, alvimopan, Entereg. This is indicated for patients who have postoperative ileus. Alvimopan is a peripherally acting mu-opioid receptor antagonist. Then we have docusate, Colas, Dulcolax. It is used for treating constipation. Docusate is an anionic surfactant that acts as a stool softener. Next, lactulose, Constulose, Enulose. It is used for constipation and hepatic encephalopathy. Lactulose is a non-absorbable disaccharide that creates an osmotic effect and also reduces ammonia levels. All right, let's move on. Metoclopramide, Reglan, It is indicated for gastroparesis, nausea, vomiting, and GERD. Metoclopramide is a dopamine D2 receptor antagonist that enhances gastrointestinal motility. Next is polyethylene glycol, Miralax. Its indication is for constipation. Polyethylene glycol is an osmotic agent that causes water retention in the stool. Going ahead with the next drug, dicyclomine, Bentyl. Dicyclomine is approved by the FDA for irritable bowel syndrome. Dicyclomine is an anticholinergic, antispasmodic agent that relieves smooth muscle spasm. Next drug is mesalamine, Asacol HD pentasa. The drug is approved for ulcerative colitis. Mesalamine is a 5-ASA derivative with local anti-inflammatory effects in the colon. Let's look at the next card. It is diphenoxylate/atropine, known by the brand name Lomotil. This is used for diarrhea. Diphenoxylate is an opioid agonist that slows gut motility, and atropine is added to deter abuse. Next drug is sucralfate, Carafate. This is useful for the treatment of duodenal ulcers. Sucralfate forms a protective viscous barrier over the surface of ulcers. Let's look at the next one. Celecoxib, Celebrex. This is used for pain, inflammation, and arthritis. Celecoxib is an NSAID that selectively inhibits COX2. Next, diclofenac, Voltaren. It is used for treating pain, inflammation, and arthritis. Diclofenac is an NSAID that inhibits both COX1 and COX2 enzymes. Then comes ibuprofen, Advil, Motrin IB. It is indicated by the FDA for pain, inflammation, and fever. Ibuprofen is an NSAID that non-selectively inhibits COX1 and COX2. Next up, ketorolac, Toradol, Acula. This is indicated for patients who have moderate to severe pain. Ketorolac is a potent non-steroidal anti-inflammatory drug that inhibits COX1 and COX2. Then we have meloxicam, Mobic. It is used for treating arthritis and pain. Meloxicam is an NSAID with preferential inhibition of COX2. Next, naproxen, Aleve. It is used for pain, inflammation, and gout. Naproxen is an NSAID that non-selectively inhibits COX1 and COX2. All right, let's move on. Baclofen, Lioresal, Gablofen. It is indicated for spasticity. Baclofen is a skeletal muscle relaxant that acts as a GABAB receptor agonist. Next is carisoprodol, Soma, Vanadom. Indications are for musculoskeletal pain. Carisoprodol is a centrally acting skeletal muscle relaxant. Going ahead with the next drug, cyclobenzaprine, Amrix, Flexeril. Cyclobenzaprine is approved by the FDA for muscle spasms. Cyclobenzaprine is a centrally acting skeletal muscle relaxant. Next drug is tizanidine, Zanaflex Ontralfi. The drug is approved for spasticity. Tizanidine is a centrally acting alpha-2 adrenergic agonist. Let's look at the next card. It is dexamethasone, known by the brand name Decadron. This is used for inflammation, cancers, and COVID-19. Dexamethasone is a potent synthetic glucocorticoid receptor agonist. Next drug is hydrocortisone, Solu-Cortef, Cortisone Diaz. This is useful for the treatment of inflammation and adrenal insufficiency. Hydrocortisone is a short-acting systemic corticosteroid. Let's look at the next one. Methylprednisolone, Medrol, Solumedrol. This is used for inflammation and allergic reactions. Methylprednisolone is a systemic glucocorticoid with anti-inflammatory and immunosuppressive effects. Next, prednisolone, Milipred, Orapred ODT. It is used for treating inflammation, allergic states, and autoimmune disorders. Prednisolone is a systemic glucocorticoid with potent anti-inflammatory effects. And the final drug in this section, prednisone, Deltasone. Rayos. It is also indicated for inflammation, allergic states, and autoimmune disorders. Prednisone is a systemic corticosteroid that is converted to its active form, prednisolone. Okay, a very important category now. Chemotherapeutics and immunosuppressants. We'll start with cyclosporine, Neoral, or Sandimmune. This is used for transplant rejection and autoimmune diseases. Cyclosporine is a calcineurin inhibitor that suppresses T-cell activation. Next, hydroxychloroquine, Plaquenil. It is used for treating malaria, lupus, and rheumatoid arthritis. Hydroxychloroquine is an antimalarial agent that impairs complement-dependent antigen-antibody reactions. Next, we have methotrexate, Trexol. This is for rheumatoid arthritis, psoriasis, and cancers. Methotrexate is an antimetabolite that inhibits dihydrofolate reductase. Let's look at the next one. Mycophenolate mofetil, Cellcept. This is prescribed for transplant rejection prophylaxis. Mycophenolate mofetil is a prodrug that inhibits inosine monophosphate dehydrogenase, blocking purine synthesis. Moving on. Tacrolimus, Prograf, Envarsus. This is approved for transplant rejection prophylaxis. Tacrolimus is also a calcineurin inhibitor that suppresses T-cell activation. Alright, next drug, anastrozole, Arimidex. This one is indicated for breast cancer. Anastrozole is an aromatase inhibitor that blocks the conversion of androgens to estrogens. Next is cyclophosphamide, Cytoxan. Indications are cancers and autoimmune disorders. Cyclophosphamide is an alkylating agent that causes cross-linking of DNA strands. Then we have imatinib, Gleevec, looking at its indications, chronic myeloid leukemia, CML, acute lymphoblastic leukemia, ALL, and GIST. Imatinib is a tyrosine kinase inhibitor that targets the BCR-ABL protein. Got it? Next card, tamoxifen, Soltamox, Nolvadex. This is used for breast cancer. Mechanistically, tamoxifen is a selective estrogen receptor modulator, or SERM. And the final drug here, hydroxyurea, Hydrea, Droxia. It's used for cancers and sickle cell disease. Hydroxyurea works by inhibiting ribonucleotide reductase. Alright, next up, hormonal and reproductive system drugs. First, finasteride, Propecia, or Proscar. This is indicated for benign prostatic hyperplasia and male pattern baldness. Finasteride is a 5-alpha reductase inhibitor that blocks the conversion of testosterone to dihydrotestosterone, or DHT. Next, tamsulosin, Flomax. It is used for treating benign prostatic hyperplasia, or BPH. Tamsulosin is a selective alpha-1, a adrenergic blocker that relaxes smooth muscle in the prostate. Next, we have terazosin, Tesruli. This is for benign prostatic hyperplasia and hypertension. Terazosin is a non-selective alpha-1, adrenergic receptor blocker. Let's look at the next one. Sildenafil, Viagra, Revatio. This is prescribed for erectile dysfunction and pulmonary hypertension. Sildenafil is a phosphodiesterase 5 inhibitor. Moving on. Tadalafil, Cialis, Adcirca. This is approved for erectile dysfunction, BPH, and pulmonary hypertension. Tadalafil is a long-acting phosphodiesterase 5 inhibitor. Alright, next drug, oxybutynin, Detropan, Oxyrol. This one is indicated for overactive bladder. Oxybutynin is an anticholinergic, antimuscarinic agent that relaxes bladder smooth muscle. Next is solifenacin, Vesicare. Its indication is also for overactive bladder. Solifenacin is a competitive muscarinic receptor antagonist. Then we have estradiol, Estrace, Climera. Looking at its indications, menopause symptoms and hypoestrogenism. Estradiol is a principal form of estrogen that binds to estrogen receptors. Got it? Next card. Medroxyprogesterone, Provera. This is used for abnormal uterine bleeding. Medroxyprogesterone is a synthetic progestin that transforms a proliferative endometrium into a secretory one. Next, norethindrone, Erin, Camilla. It is used for treating contraception and abnormal uterine bleeding. Norethindrone is a progestin-only contraceptive that thickens cervical mucus and thins the endometrium. Alright, let's move on. Testosterone, Androgel. It is indicated by the FDA for hypogonadism. Testosterone is an androgen that binds to androgen receptors. And the final one in this group, drospirenone/ethinyl estradiol, Yasmin, Yaz. It is indicated for contraception, acne, and premenstrual dysphoric disorder. This is a combination oral contraceptive that suppresses ovulation. And our final section, ophthalmic agents. Kicking this one off, we have brimonidine, alphagan P, Koliana. This is used for glaucoma and rosacea when used topically. Brimonidine is a selective alpha-2 adrenergic agonist that reduces aqueous humor production. Next is latanoprost, Xalatan or Xelpros. This is also for glaucoma as well as ocular hypertension. Latanoprost is a prostaglandin F2 alpha analog that reduces intraocular pressure. And our final drug, timolol, Timoptic Istalol. This is used for glaucoma. Mechanistically, timolol is a non-selective beta blocker that reduces aqueous humor production. You've successfully completed all 250 high-yield drugs. You did it! Found this helpful? Don't forget to like and subscribe to Logical Pharmacology. We logify the tricky stuff so you don't have to cram.